Hey you guys, it's me Adam Deshawn here with another video. So this is going to be 5 things that they don't tell you at nursing school, or at least they didn't really teach me a lot in nursing school, and I think that nursing students today really need to know these things in order to be really successful in their nursing career. So the first thing I want to debunk and things they really don't let nursing students know is that you can go right into your specialty. Back when I was in nursing school, it was kind of like they wanted everybody to start off on med surg or some type of a general unit when it comes to nursing. That is not true. These day and age, nursing and nursing managers, coordinators, care coordinators really don't mind hiring new grads. And to me, it's better to go ahead and learn your skill set and your specialty so you don't have to go into a specialty trying to relearn something. You know, if you want to go into neonatal, go into it. If you want to go into pediatrics, go into it. If you want to go into the ICU, go right into it. Don't wait. The worst they can say to you, if they really want somebody with more nursing experience, the worst they can say is no. And then what you do, move on. So the next thing I want to focus on, and it took me a while to learn this, and I really don't I think they do this, but I want everybody to know that doctors are not your bosses. Just sit with that for a little bit. Doctors are your coworkers. They are not your bosses. So they are not allowed to disrespect you. If they disrespect you, get right with them. Okay? You have to give respect to get it. Doctors are not your superiors. They're not your bosses. You are not their subordinate. Your nurse managers, nurse supervisors are your bosses and superiors, but doctors are not. You are co-workers and you are supposed to act as such. So if you get that one doctor who acts like nurses are beneath them and he thinks that he can speak to nurses any type of way, he cannot, he will not. Do not allow yourself to be disrespected by really anybody, because they'll all try to come for you, but get them right together in that moment and they won't do it again. I promise. The third thing that they do not teach nursing students is to take care of yourself. You are in a really high stressful, risky, high pressure situation, and you go through your shift at a heightened sense of anxiety for 12 hours. That can't be good for anybody's health, heart health, or mental health. So take care of yourself after your day is done. Indulge in some things that really nourish you mentally, physically, emotionally, spiritually. You have to take care of yourself, because a shift will completely drain you. And this goes into a lot of, nursing managers are into like this. Oh, can you come in an extra shift to help your team? Can you come in and help your team? I'm all for teamwork, but at the end of the day, is the team going to pitch in on my therapy expenses when I have a nervous breakdown? No, they're not. So I get the team aspect of it. I'm an advocate for teamwork when it comes to a clinical unit or a workplace, but also I am also an advocate for self-care. So take care of yourself adequately, because you can't continue to go and be at this heightened state of anxiety all the time. This is not benign. This will catch up with you eventually. Take it from me. 17 years in the business. I know I don't look like it, but 17 years of nursing. Please take care of yourself. Hey y'all, I'm sorry. I'm sitting here editing the video and realized that I forgot the whole 4th step, which is time management. I do not believe that nursing instructors and nursing schools focus on time management during clinical, because you only typically have 1 to 2 patients per student. You may be giving meds, you may not be giving meds. You're doing bed baths and stuff like that. So I just think that time management will absolutely make or break you when you go into practice. If you do not know how to manage your time wisely, when you get by yourself, when you become a nurse, your shifts are going to be trash. So time management. Okay, back to the regular video. The 5th and final thing that I think that nursing schools need to really, really, really harp in on is how to develop proper bedside manner and interpersonal skills. Like the new nurses are really they're not getting this bedside manner, and I don't understand like where this is coming from. I don't know if it's like is it the Gen Zs? Yeah, the Gen Zs are coming out, or maybe the earlier millennials are coming out with this sense of entitlement. But you guys, you have got to have proper and adequate bedside manner. This will absolutely make or break your nursing shift, and it will also make or break your patients day. You know, my mom was recently in the hospital and I had to be with her for just over a week. And when I tell you that just being on the other side of the healthcare spectrum, having proper bedside manner, like, is the GOAT. Like, it, like, even though you don't have to be the smartest nurse, you don't have to be the most skill savvy nurse, you don't have to be able to start an IV on the first try, you know, you may not be able to give the perfect injection, but let me tell you, if you have proper bedside manner and proper personal skills, that does not matter. So I think I did have a nursing instructor during my clinical rotation back when I was in nursing school, just encouraged us to talk to our residents or our patients about their lives, what's going on with their lives. We had to come back with one personal detail we learned about that patient, not their lab values, not what their plan of care is, not if they had a bowel movement, not what their pain level was, but what is one personal detail that you learned about that patient. Bedside manner is king, and it is crucial to an optimal patient experience and your experiences too. If you have not already done so, you guys, please like and subscribe. Like the video, subscribe to the channel, hit these notification things so you guys can be aware when I upload videos. Because for some reason, I'm not getting the views I think I should. Hello, YouTube. Follow me on Instagram if you have not already done so. Comment below what are some things that you guys think that nursing schools should be teaching students during their clinical rotation. All right, see you guys in the next one. Happy nursing. Bye.